the mammography to you. We have mammography. Mammography is a specific type of imaging that uses a low dose of X-ray system for examination of the breast. And we have the common uses of the procedure. The diagnostic mammography is used to evaluate a patient with abnormal clinical findings, such as a breast lump or lump that have been found by the women or her doctor. And now we have the equipment of the mammography. We will explain to you the equipment of the mammography. A mammography is a unit, a rectangular box that houses the tube in which X-ray is produced. And the unit is dedicated equipment because it is used exclusively for X-ray exams of the breast, with special accessories that allow only the breast to be exposed to the X-rays. And attached to the unit is a device that compresses the breast and position it to the image can be obtained at different angles. We have the breast compression is necessary in order to press out the breast thickness so that all the tissue can be visualized, and they spread out the tissue so that the small abnormalities won't be obscured by overlying breast tissue. Allow the use of lower X-ray dose since a thinner amount of breast tissue is being imaged. Hold the breast still in order to eliminate blurring of the image caused by motion and reduce the X-ray scattering, increase sharpness of the picture. This is the picture of the mammography devices that makes the compression to the women's breasts. And the preparation of the mammography for patient. We will explain the preparation of the patient to mammography examination. Remove deodorant, talcum powder or lotion under the arms on the breast on the day of the exam. These can appear on the X-ray film as calcium spots. Patient must be described any breast symptoms or problems to the technologist performing the exam. Previous mammograms must be available to the radiologist at the time of the current exam. In addition, before the examination, the patient asked to remove all the jewelry, clothing above the waist, and will be given a gown that opens in the front. This is the mammography and X-ray examination, the picture of the examination of the breast. This is normal breast. Mammography of breast cancer. This is abnormal. The breast has the cancer. Yes. And we have the limitation of mammography. Interpretation of mammograms can be difficult because of a normal breast can appear differently for each woman. Also, the appearance of an image may be compressed if there is powder or salt on the breast or if you have to undergo breast surgery. And not all cancer of the breast can be seen on mammography. Because we have so many different types of the cancers. And the breast implants can also impede accurate mammogram readings. And we have the recommendation calls us screening mammography. We have to take the examination of the breast mammography. We have the anatomy of the breast. We have the tissue of the breast. There are three types of the tissue. We have the glandular, fibrous or connective tissue, or epidermis. The epidermis always will be fat. We have types of breast tissue, two types, and the glandular and stromal. We said that the glandular, ducts, lobes, lobules, TDLU, and we have the stromal, which we said the previous slide, fatty tissue, connective tissue, and the Cooper's ligaments, and suspensory ligaments. This is the picture of the tissue of the breast. We have
اليوم عندنا سيمنار عن جهاز الماموغرافي الأجهزة الطبية، أجهزة طبية شعاعية. طبعا في اغلب الاحيان في اغلب العموم العالم يكثر مرض سرطان الثدي، وهي المرض لها جهاز خاص اسمه جهاز الماموغرافي اللي يفحص المرض عن هذا المرض الثقب. Mammography is a specific type of imaging that uses a low-dose X-ray system for examination of the breast. الماموغرافي يستعمل لتعميم. Mammography unit is a rectangular box that houses the tube in which X-rays are produced. الماموغرافي عبارة عن صندوق مستطيل فيها اسمه هناك أنبوب الأشعة إكس-راي يطلع، ومنها الكمبريشر ديفايس الضغط، منها يضغط على الثدي ويتنزل، تقدر تتحكم عليه بزاوية 90 درجة أو بزاوية 45 درجة حسب الدرجات، تنزل تضغط على الثدي وتاخذ أشعة. Breast compression is necessary in order to الضغط الثدي، الضغط منها ضروري جدا لفحص الثدي، لأن من تضغط عليه يضغط على الثدي ويطلع الأنسجة مال الثدي ويبين عندك الثقوب المرض أو الثقوب في الثدي. Spread out the tissue so that small abnormalities won't be obstructed by overlaying breast tissue. Allow the use of lower X-ray dose since the thinner amount of breast tissue is being imaged. Hold the breast still in order to eliminate blurring of the image caused by motion. هذه الصورة يوضح صورة الأشعة السينية الماموغرافي. هنا الإكس-راي منظر الأشعة منها عبارة عن أنبوب مستطيل يلقي الدوز ومنها ينزل على الإكس-راي الأشعة، وهنا كومبريشر فيلم بلاي، الفيلم يخلي هنا الفيلم، وهذا الكومبريشر الضغط على الثدي وياخذ أشعة. Preparation for mammography. Remove deodorant, talcum powder or lotion under the arms or on breast on the day of the exam. These can appear on the X-ray film as calcium spot.